And welcome back. Well, the air is full of pollen and mold. Doesn't it sound good?
Yeah.
And the airwaves are full of commercials for over-the-counter allergy medications. You've seen them all. But are these drugs the right way to deal with your problems?
Yeah, Dr. Madan Kandula from the Sinus Center and Advent is here today with something to consider if you are one of the many that suffer from seasonal allergies. And there's so many people who suffer from seasonal allergies. What's the thing that we should be considering? You know, we talk about, seasonal allergies, we talk about hay fever. They're used quite commonly, but what specifically is an allergy?
An allergy specifically is your body, so if somebody has an allergy, their body is reacting to something that it shouldn't forcefully. So meaning like pollen, dust, those sorts of things. Your body shouldn't care about those things, but for most folks' bodies, they don't. If somebody has an allergy, you breathe those things in, and your body reacts by trying to get those things out.
It's sort of an overreaction, right?
Big time, and sometimes sometimes it can be deadly. So your body, stuffs your nose up, causes itching, sneezing. It just tries to get it out, and sometimes it can be so forceful it just shuts you down. So there's something called anaphylaxis when somebody can't breathe. So that's obviously gone to extreme, but a lot of folks have those issues. A lot of folks don't know what to do with those issues. A lot of folks don't know is that what's going on for me? So yeah.
It happens every time I get to my desk in the morning, so I've just assumed I'm allergic to work.
Yes, that's very common, actually. Yeah. It's contagious. Yeah.
People this time of year, because so many of them are agitated this time of year with blooming and the dust and everything kind of coming out, there's so many commercials out there for all the over-the-counter products. How do you know what really works and what do and what don't they treat?
Yeah, it's the hard thing. So the good news, a lot of allergy medicines they're very safe, they're very simple, that's great. A lot of them have gone over the counter here over the last decade or so, which is fine, but a lot of folks sort of get stuck in you go to the grocery store or the pharmacy, you sit there and stare at the aisle, and there's thousands of things in front of you, and it's just a matter of trying to figure out what's going to work for you. And I know what's in all of those things, but even for me, if you stood there and started looking, it's very confusing, and that's why you hear all the ads, because the ads are trying to kind of sort of say, hey, we can help, and some of those things certainly can help. There's some very good allergy medicines out there. There are very good allergy medicines that are over the counter, but they're certainly not a one-size-fits-all, and there are many issues that those allergy medicines really can't treat.
And that's interesting to point out, because there are so many different over-the-counter. I think people think, well, I should be able to figure out which one is right for me, because I know my symptoms, so I should be able to just pick the right one for me.
Absolutely, yeah, and that's understandable. It just sort of seems logical. Well, if this is FDA approved, if this is simple enough that I should be able to take it, whenever I need, then I should figure out what I need, and you might be able to. You might luck into it, but a lot of times you don't. And yeah, go ahead.
What's the most common complaint? Is it the sneezing? Is it the itchy eyes?
It isn't, actually. So the most common and the most frustrating symptom for most folks who have allergy issues is the congestion. So meaning you just can't breathe through your nose is the big thing. So your nose is your start of your airway, and so that's why most folks who have allergy issues, they feel it in the nose, because the nose tries, that's a simple place for your body to shut it down.
It itches.
It itches, it stuffs, it sneezes, it runs, it just tries to get it out, basically. But the stuffiness is something that's there. A lot of folks have that, in allergy season, but for many folks that lingers and gets worse and worse and worse year after year and after year.
Are decongestants then always the answer?
They can help, and sort of a dirty little secret in my little ENT world is that a nasal decongestant like Afrin and Neosynephrine are very common ones. Those work better than any prescription medication that I've got to give, and any other medications that are over the counter. The problem is those medications are addictive, and you get a rebound effect in using them. So you get this little window of, you spray it in there, you feel like the world is yours. You can breathe all of a sudden, and that window closes though after about 12 hours or so, and that keeps getting shorter and shorter. Then once that wears off, now you're stuffier than you started from, and then it's a very, very common thing for folks to get addicted to it, because like I said, as far as other medications, they don't replicate that.
A good thing to avoid then.
It's tempting. I mean, there are rare instances where I'll have folks use it very, very temporarily.
Or if you're flying.
If you're flying, or if you've got a cold, or certain times fine, but a lot of folks are stuck with it, and they know it. They know it's not a good thing to do, but that's all they've got. That's all they think they've got, because that's all they know.
So somebody's kind of bouncing back and forth between, okay, I've been using all these medications, they're not working the way they used to, I'm having all these issues still. What do? They come in and meet with you to get an evaluation to see if there's something else going on, or just check out their allergy?
It depends. I mean, so if you have allergies, that doesn't mean you don't have anatomy issues, doesn't mean you don't have sinus issues, doesn't mean you don't have other things. If you've got allergy issues, those allergy meds should be treating most of your symptoms. If they're not, there are things that, either anatomically or otherwise we can do to help to figure it out. We can do allergy testing, we can do allergy immunotherapy. There's a lot of different options out there, and sometimes it's very simple. It's as simple as evaluating somebody and letting them know, hey, these are the medications that can work for you.
Yeah.
And then a lot of times it's there. We've got very, very simple things we can do in the office nowadays for that person who's stuck on the decongestants. A 10-minute procedure can open up their nose, for the long haul. They're not, they're not stuck anymore. They've got that relief that's lasting. And so there's a lot of things that are out there. It is it's a very common issue. It shouldn't be oversimplified, but it's sometimes, isn't. Once we can figure it out, we can get some answers, get a very simple solution, get a game plan together.
Well, I think anytime you can avoid putting medications and drugs in your body, if you can, it's a better solution. So if you want to go in for an evaluation at the Sinus Center, you can do that. They're right on North Mayfair Road in Wauwatosa. The phone number to call to set up your appointment is 414-771-6780 or advent.md.com. You don't have to be that person with the hot rag or cold rag over your eyes all summer long.
That sneezing person.
Yeah.
Thank you so much,
Thanks,
Doctor.
Thanks for having me.
Great to see you.